Good morning. Assalamu alaikum, everybody. Welcome to our program on health here with the ShuraTV. I welcome you guys all, and hopefully you're doing well. We're here in the last week of June, or the last day of June, May, and the beginning of June. And we just had Memorial Day yesterday, so it's the non-official start of summer, and we wanted to remind everyone that since the weather is going to be getting warmer and we're going to have hotter days, it's important to keep yourself hydrated and to keep yourself well nutritioned in terms of getting enough fluids and liquids so you don't have dryness in the body. Most of us have some sort of lack of fluid in the body because a lot of us don't consume enough water and enough liquids in a day and enough fruits and vegetables. So we tend to be dry, but in these summer months coming up, June, July, August, I'd like to remind you to make sure that you have enough water intake, which is very important, especially if you have elders and young ones around you. The young ones and elders tend to forget to keep hydrated, so it's important that you remind them to keep their hydration up so that they can have overall optimal health. And it also prevents a lot of the aching joints and the pains and a lot of the stomach issues that come up if you're hydrated. It's very important to keep your nutrients and your body fluids in proper levels. That's something important to keep in mind. That's just a little bit of a reminder because the hotter months are coming up. And also, if you're at picnics and if you're at summer barbecues and things like that, make sure that you keep your food and don't leave it out long in the sun and in the heat, because that'll go bad, and then a lot of people get different stomach viruses. And God forbid, we don't want you to get any kind of infections in terms of your stomach and your GI system, because that'll kind of, take you out for 3 to 4 days at least. So keep in mind as you're enjoying the summer picnics and barbecues and things like this that are coming out, outings, don't keep your food in the sun for a long time because it will go bad. And then once you eat it, it'll cause issues for your stomach, viral or bacterial. So, and currently there is a ban on Jif peanut butter. They have an E. coli breakout. If you haven't heard, if you're someone that has Jif peanut butter in your cabinet or in your house, get rid of that. They're all been recalled. The creamy, the crunchy, all types of it, because there's been an E. coli breakout where they've discovered that it was contaminated with bacteria. So keep that in mind as well. That's something current. And finally, another general information on COVID and how it's going. COVID has increased a little bit in terms of its viral load, and especially if you're going to these crowded graduations and gatherings and celebrations, I encourage you to wear a mask and protect yourself and your family so that you can enjoy more outings moving forward rather than isolating yourself and quarantining yourself in the home. So if you're going to indoor activities that are crowded and you don't know a lot of people there, we encourage you to please wear a mask. And even if you're going to your congregational prayers inside a place of worship, the numbers have gone high. We have more than 90,000 infections per day now in the US. For a comparison, last year at this time, it was only a fifth of it. So right now it's 5 times more than it was last year. Of course, there aren't any major mandates or anything, but just for yourself and for your families and for your community to be safe and to be COVID-free, can take precautions and at least wear the mask indoors in places where there's huge crowds. That's something important to keep yourself healthy and for you to enjoy your summer and enjoy your outings and enjoy your get-togethers with your families. And also, if you haven't gotten the booster I encourage you to get the booster, especially if you're very young or very old, and or if you have a another condition like high cholesterol, high blood pressure, autoimmune disease, any kind of heart conditions, or any diabetes. People with diabetes are 3 times more higher likely to get hospitalized with COVID than those that don't have diabetes. So that's something important. We're going to talk about diabetes today. That's the topic of our short discussion today, just about diabetes and how rampant it is in society today. But if you do have diabetes, you should exercise extra precautions so that you don't get COVID, or if you do, you got to take care of yourself very well. So that's very important to keep in mind. These are things that are going on right now in society. Be careful and be aware and stay safe. And remember, you always have to be an advocate for your health and for your own family's health, so that you have a quality of life moving forward and enjoying your summer and enjoying celebrations and get-togethers with family and friends. It's always important to keep yourself safe and sound. So that's our tidbit about that. What we want to do is discuss today a little bit about diabetes and how we can recognize the signs and symptoms of diabetes and why it's so prevalent in society, and what we can do to avoid getting it, and maybe discuss some preventive measures so that we keep ourselves from getting diabetes, especially in a society where there's a lot of processed and genetically modified foods. In Europe, genetically modified foods have been outlawed. It's against the law to have those, so they don't have them, which is great. But here, unfortunately, in North America and the U.S., GMOs, or genetically modified foods, are still existent, and they're still legal for the manufacturers to make. So processed foods and genetically modified foods are things that tend to lead people to more diabetes. So that's something where you have to make sure that you try to eat a clean and healthy diet. That's something important, because that'll prevent a lot of ailments, including diabetes. So, diabetes, what is it? It's basically, a group, a subset of pathologies that end up with increased sugar in the bloodstream. So basically, your sugar metabolism is altered, and the alteration of the sugar metabolism is done in different types of environments. One environment would be that your cells, or pancreatic cells, are not functioning properly. They're not producing enough insulin so that it can balance out the glucose when you eat food. When you eat food, you get a rush. You get a rush of insulin that comes out of the pancreas, and what that does is that balances out the sugar that comes from the foods that you eat, the carbohydrates or the sugars. Your brain needs sugar. Your fat metabolism in the body needs sugar so it can function. But what happens is you get excess sugar. Once you get excess sugar, then this is the problem, and that excess sugar causes inflammation in the body, whether it's your small vessels, which diabetes affects, or your kidneys, or your fingers and toes and legs and hands. These things are all affected by high sugar in the body. And a lot of the functioning of your organs gets altered when you have high levels of sugar. And this sugar has to be kind of counteracted with the insulin. And we have to find out what the issue is in people. And things that kind of lead to this increased amount of sugar, obviously, the number one thing is a sedentary lifestyle and the types of food you eat, obviously. So, as I mentioned before, processed foods, foods that are genetically modified, high sugar carbohydrate foods, high sugary foods. What you want to do is keep it in the middle. You don't want to go to extremes. You don't want to completely eliminate sugar from the diet, and you don't want to have excessive sugar in the diet. You just want to have enough so that the sugar in your body is balanced out, and you have enough insulin that's being pumped out by our pancreatic cells so that it balances out that sugar and uses it for fuel rather than stores it and then causes it to become fat. And that's what you want to prevent. So that's very important to keep in mind. Unfortunately, in the US now, I think 1 in 11 people, or 1 in 10 to 11% of the population has some form of diabetes. There's type 1 and type 2. Type 2 is much more common. Type 1 is a genetic deficiency, which they call juvenile onset diabetes, which is a lot of people get it when they're young, and that's a genetic issue. But in terms of type autoimmune and genetic, type 2 is the acquired, and that's done specifically because of the sedentary lifestyle, the processed foods, the lack of exercise, and also the obesity epidemic that's going on here in the US. We have over 63% of the population, which is defined as obese, which is above and beyond what their weight should be for their height, and their BMI, which is their basal metabolic rate, is much higher than it should be. So this is something we have to kind of pay attention to as a society, as a general health issue for all of society, because this is happening now. And they attributed, many of the white papers that I read, they attributed this increase in diabetes strictly to the diet, the types of food that we're taking in, and the amounts. And as you notice, also the sugary drinks and the extra large drinks that people are just sipping up and not really thinking about, that has a detrimental effect on the body, and it causes a huge spike of sugar in the body, and that's not normal. That's not something which our bodies have been made for. But unfortunately now, as we see in the Western world, especially in the US and Western Europe, in Scandinavia, as the obesity epidemic increases, we'll also see the number of diabetes patients increase as well. And it's a staggering number. And daily we see children now, a lot of children with type 2 diabetes because of the type of diet that they have. It's very important to keep that in mind. It also leads to dysfunction of fat metabolism in the liver. So you get a lot of what's known as fatty liver. And once the liver doesn't function properly, then it adds to other hormonal issues for the children and for the adults that have this pathology. It's very important to keep in mind that things to do to prevent yourself from getting diabetes are, number one, would be a regular exercise routine, and number two, to watch what you eat in terms of the balancing the carbs and the proteins and the fats. You don't want a very high carbohydrate diet, and what you want to do is you want to consume very good fats. You don't want bad processed fats. You want good fats, and it's very important to keep that in mind. And then, of course, lean proteins, it's important as well. And inflammation and increased sugar has been linked to a higher intake of meat as well, red meat. So that's something to kind of maybe control and not have it, twice or three times a day. Maybe have it once a day, or once or twice, 3-4 times a week. Red meat. That's something which also has contributed to the diabetic epidemic here in the US. So it's important to keep that in mind. In general, the recommendations are, of course, we as a nation don't get 5 to 7 servings of fruits and vegetables a day. That's something which would definitely impact the diabetic incidence rate. It would drop if everybody started taking their vegetables and fruits per day to the amount that's recommended. That would definitely drop the amount of diabetes that's out there. And then, of course, there are other lifestyle factors, as I mentioned before. A sedentary lifestyle, they recommend, if you're driving your car to a grocery store or a movie theater, they recommend parking far from the place so you walk more. It's very important to get activity in. At least the recommendation is to get 30 minutes, 3 to 4 times a week of activity, which increases your heart rate, and that you're really, huffing and puffing and breaking a sweat. That's something that's very important, and it's very beneficial to the body. So that's something which is emphasized by all unanimously. The other thing that we wanted to discuss is some of the signs and symptoms that you notice that this you might be getting diabetic is excessive thirst, excessive urination, um, in men, erectile dysfunction, a lot of gained weight. That you notice, especially if you're above 45 or your mid 40s, and you suddenly gain a lot of weight. You got to check yourself out so you're not pre-diabetic, because some people get on the borderline. And what you do simply is go to your doctor, and they'll check you out, and they'll tell you exactly what your risk factors are for diabetes, and they'll do a blood test and check your sugars. That's something important that you can do. Also, the other thing that you can do is, they have the home tests that you can do nowadays as well. You order it, and basically you do a little pinprick on your finger, and then you put the pinprick in the little machine, and that'll give you a reading of your sugar, and it'll tell you. And if you get a consistent reading several times, post meal and pre meal, and then it'll have the parameters. It'll let you know exactly if you're in diabetic range. And then if you are, you have to make a lifestyle change. The number one thing that your doctor will tell you initially is to drop pounds. Definitely. You have to go on a caloric restrictive diet so that you can lose some weight, and then, preferably do some exercise and alter your food intake, the types of meals that you take. And if you do that persistently and consistently, and we see many people that beat diabetes and get out of the range of diabetes, and they even get off their medications. So that's something that's definitely possible to do, but it's important to have the mindset and the determination to do it. That's the important thing. We've seen many people that have had diabetes, and they come in and they do they get on a program where they have caloric restriction. They change their diet in terms of the types of foods they eat, and they go more to vegetables and fruit, and a little bit of a low carb diet and good fats. This and I've mentioned this multiple times. A Mediterranean diet, and you can Google it to see what it is exactly. But if you follow the indications for a Mediterranean diet, and you can Google that up to see what that is exactly, that's most conducive to optimal health. Many studies have shown that a Mediterranean diet is conducive to optimal health. It's not too extreme on one end or the other. And as people with diabetes are recommended to be on a Mediterranean diet. They take the olive oil, they take the salads, and they keep the carbohydrates low, and they consume good fish and white meats and chicken and things like that. Some red meat, but not too much. And this puts the body back at a place where it prevents getting these illnesses, as well as high blood pressure and other comorbidities and mortalities that come with this disease. So you have to keep that in mind. If you're diabetic, your risk of stroke is 3 to 4 times more than the normal population. Your risk from heart disease, other types of illnesses, is increased in general. So it's to your benefit to try to get rid of this diabetic status. And the best way to do it is initially, if you're diagnosed initially, is through the lifestyle, to what you consume, exercise, and to alter that sugar metabolism in your body. There are some supplements and herbs that you can take that actually alter the sugar metabolism and decrease the burden of sugar on your body and on your organs. There are things like that that you can do. That can be discussed as well at a later time. But these are the things that you would do initially. If you can't do it yourself, then of course, if your level is so high, we don't want you to go into a hypoglycemic shock during the day. So we want you to take the medication. Take the medication that the doctor has prescribed for you, whether it's metformin or some other glyphosate or some other Ozempic. There's different types of medications. There's several different classes that your doctor will recommend based on your condition and the level of severity of your diabetes. So it's important to keep that in mind and listen to your doctor. But at the same time, if you can alter your food intake, if you can alter your exercise levels, and if you can change the types of food you eat, you can beat the diabetes. It's totally possible, but you got to put your mind to it, and you have to have the determination and will to do it. That's important. And then, the processed foods you got to stay away from. These kind of things definitely are not conducive to a healthy lifestyle. And of course, exercise, right? At least 3 to 4 times a week, 30 minutes, do something, keep active, even if you have to walk fast or do whatever you got to do. If you can do those things, these things will decrease the sugar levels in your body, and your body will deal with that with the sugars much better than normal circumstances of a sedentary lifestyle with processed foods and obesity. So that's something important to keep in mind. Unfortunately, this epidemic of diabetes is not just confined to North America now. All our fast food exports that we have to the Middle East, these countries like the Khalij areas, Qatar and Abu Dhabi and UAE and all these countries that have taken in the American fast food lifestyle, these countries also, we see that diabetes is spiking up very high, very high. Obesity and diabetes hand in hand. So it's something which is, in places where there's this fast food culture and the foods are processed and they're being consumed in large amounts. This is something to keep in mind, and especially when it comes to your children, it's important to give them wholesome foods and foods that are not processed, that are actually cooked for them, and not something which is fast food. That's something that I would encourage you to abstain from. It's very important to keep that in mind, and hopefully that'll give them a healthy life, and it wouldn't give them the pre-diabetic stage that we see all around us now. So it's important. It's something to keep in mind. It's nothing to stress about, but it's something to slowly work at and get ahead of, because this is here in our society. It's around, and we need to make sure that we're cognizant of it and we know all the ins and outs about it, so that we can actually react and respond to it and have a plan when it comes to ourself, number one, because self-care is important. You take care of yourself and then take care of others, and then for your loved ones and your family and your extended community. That's something to keep in mind. And if you need more information or more resources on how to get ahead of this diabetic epidemic or obesity, you can always contact us, make comments so that we can get back to you and help you, achieve optimal health. With that, I'd like to thank you for listening, and we'll see you next week on our health program. Thank you.